Hello everyone. Today we'll go over a brief history of blood pressure and a short tutorial on blood pressure assessment. Joining me today is Ariana Rodarte, Jacqueline Soto, Alfredo Gonzalez, Chris Owens, and myself, Johnny Rosari. The sphygmomanometer, aka the blood pressure cuff, was introduced November 8, 1905 by a Russian doctor and scientist by the name of Nikolai Korotkov. This was a new and accurate way to measure arterial pressure. There are 5 phases to measuring blood pressure. First, you have your systolic number, which is a clear tapping sound, followed by a swishing noise, loud tapping, a blowing sound, and then last, number 5, your diastolic number will be silence.
When the patient walks in, it is important to introduce yourself to them. This is to make them feel comfortable and at ease. As they take a seat, please ensure that their posture is straight, their feet are flat on the floor, and the arm that is going to be taking blood pressure on is shown bare arm, and the arm is elevated at heart level.
After ensuring that these procedures are corrected, have the patient rest for a period of 5 minutes and ask them a series of pre-assessment questions.
Such as if they had any caffeine, nicotine, and plenty of rest.
You're going to want to make sure that the blood pressure cuff you have is the proper size for an adult.
So we're gonna have to wait about a 5-minute period before we take your blood pressure, so we're just gonna have you rest for right now. So where did you actually have your coffee this morning from? Starbucks.
You're going to want to place the blood pressure cuff on a bare arm if you need to roll up the sleeve to do this. You're going to double check the cuff size just to make sure it's the proper size for your patient. You make sure it's not too tight or too loose. Make sure it fits properly. You're going to want to make sure your prongs are facing forward. Make sure the bell, the stethoscope, is on, placed on the brachial artery. When you inflate the cuff, you're going to make sure the valve is tightened clockwise.
After checking your equipment, you are now ready to begin taking your blood pressure. Place the bell of the stethoscope over the brachial artery and be sure to not place it under the cuff. Turn the valve to the right, inflate to 180 mmHg or 20 above the first Korotkov sound. Turn the valve to the left to release at a rate of 2 to 5 millimeters per mercury per second. At this point, you would want to listen for the consistent 5 phases, a clear tapping sound, the first one being the systolic number, followed by swishing noise, then a crisper and louder tapping. The last tapping you hear is also known as the diastolic number.
You had 150 over 90.
You had 150 over 90. You had 150 over 90.
After taking your patient's blood pressure, you want to compare his systolic and diastolic numbers to this chart. There's several classifications of resting blood pressure for adults. Normal being anything less than 120 over 80. If you recall, the patient had a blood pressure of 150 over 90. This is considered hypertension stage 1. Anything higher than 180 and 110 is considered hypertensive crisis, and your patient will need emergency care immediately.
Okay, Mr. Doe, you said you had coffee this morning, correct? Right. Okay, your blood pressure is a little bit elevated. We had it at 150 over 90, which would be kind of considered in your hypertension range. So you aren't on any medications? Have you seen any doctor for this? No. Okay, we might want to recommend you because you do have a little bit of an elevated blood pressure, just in case, so we can treat the hypertension.
Systolic blood pressure is the maximum pressure in the arteries when the ventricles of the heart contract during a heartbeat. Diastolic blood pressure is the minimum pressure in the arteries when the ventricles relax. Hypertension or high blood pressure is a condition in which the resting blood pressure, either systolic blood pressure or diastolic blood pressure, or both, are chronically elevated above the optimal or desired level. If hypertension is left untreated, it will eventually cause heart disease. I want to thank everybody for watching, and I hope you enjoyed the video.